Hello everyone. Today I'm going to show you how to administer nebulizer treatments. Is anybody here knows what is a nebulizer treatments? True. A nebulizer treatment is a device that delivers a small amount of medication through the airways. And I'm sure that most of you have dealt or lived with someone who has respiratory issue and asthma. In order to effectively and safely administer nebulizer treatments, you have to follow 4 steps, which is infection control, assessment, implementation, and education. For the first part, infection control, you have to wash your hands at least 20 seconds to kill any microbes and pathogens in your hand before administering the medications. For the second part, we're going to use the stethoscope to listen to the patient lung sounds, and we're going to use the oxygen saturation sensor to measure the amount of oxygen in the patient lungs. For the third part, which is implementation or preparation, we're going to use the tube that's connected the nebulizer to the oxygen tank, and we're also going to use the medication, which is albuterol. It's kind of medications that help the patient to expand their lungs and breathing better. And the last steps, which is educations, we're going to educate the patients and demonstrate how to effectively inhale the medications. Let's move to the first or second step. We're gonna place the oxygen saturation sensor between the patient finger. The normal range for oxygen saturation is between 95 and 100, but we know that the patient has a respiratory issue, so we expect it to be low. Then now we're gonna listen to the patient lung sounds. By assessing the patient lung sounds and the oxygen saturations will help us determine the effectiveness of the medications. Now we're gonna move to the third part, which is implementations. We're having the nebulizer device. Gonna open the medication, emptying it in the nebulizer cup. Then close it. Then connect the tube. Then now go to the patient bedside. Now we're gonna educate the patients how to inhale the nebulizer treatments. First, you have to make sure the patient is sitting on the upright positions. So that will help the patient inhale the patient easily. Second, we have to make sure and tell the patients to keep the mouthpiece between their lips and inhale the medications and keep them for a couple of seconds inside, so that will allow the patient to expand in their lungs and help them breathing better. Now we're gonna connect the tube to the oxygen tank. Put the oxygen on 10 liter and place the mouthpiece between the patient mouth. Now, you have learned how to administer a nebulizer treatment. It's very important to follow these 4 steps, which is infection control by washing our hands for at least 20 seconds, assessing the lung sounds and oxygen saturation, prepare our items by connecting the oxygen tube to the nebulizer device and the oxygen tank, and educate the patients how to use the nebulizer treatments. Now you have saved or helped one of your family member by learning how to use a nebulizer treatment. Thank you for watching my video.